Thank you, Amy. So as Amy mentioned, I'm going to present on an outbreak that actually happened in upstate New York a few years ago. So it's not extremely recent, but I think that it highlights some really important things that I wanted you all to know. And just so you all know, as Amy mentioned, I work at the diagnostic lab now, so I'm not out in the field anymore. So I'm approaching this case from a bit of a different perspective. I wasn't the vet who went to the farm, so all of the knowledge I have from actual physical exam findings and the farm itself is kind of secondhand from the submitting veterinarian. All right, there we go. Okay, so first off, I just wanted to go over a little bit about what an ionophore is, because I know we have kind of a mixed audience in here. So ionophores they're antimicrobials, but they're used exclusively in the animal industry. They're not used in human medicine. And they're found, oftentimes, they're used as feed additives, primarily in ruminant and poultry feed. And the purpose of ionophores in feed for these species is really twofold. So they're used to control coccidiosis, so that's one use. And then also, they act, and this picture up here kind of shows their modes of action. So they're called ionophores because they help transport ions, such as calcium, magnesium, potassium, across biologic membranes. And in doing that, they can alter the bacterial population within the rumen. And that can have effects, positive effects on growth. So these animals can grow more efficiently. It can also reduce metabolic disease that we see in cattle. So that's why they're used. And in my neck of the woods, they're in cattle feed and poultry feed oftentimes. And then at the bottom there, I listed the common ionophores that are labeled for use in the US. I don't know about ionophores in the rest of the world, but I would say the first three, monensin, lasalocid, and salinomycin, are the most common that I see in feeds in my neck of the woods. Okay, so why should we care about ionophores in a talk about donkeys? Well, donkeys, horses, ponies are all very, very, very sensitive to toxicity from ionophore ingestion. So what happens when an equine of any sort ingests ionophores is that that same mode of action that I mentioned in the previous slide happens, but it seems to affect muscle cells as well. So muscle cells, skeletal muscle and myocardial muscle, so heart muscle, are affected. And what we see as a result of that is cardiac disease and oftentimes death. And just so you all know too, the pictures in this presentation are not at all from the farm in question that I'm going to get to. They're actually my own critters. So yeah, I just put in pictures to make it interesting. And I have some numbers there. So the LD50, the median lethal dose, that's really defined as the dose that if a population is exposed to that dose, half of the population will die, just so we're all on the same page. So the LD50 for equines is thought to be around 2 to 3 parts per million, so that's pretty low. And I will tell you that equines will die at lower doses than that too, but that's thought to be about the LD50 in equines, and it can vary. And then just to contrast that, if you look down here, you'll see for cattle and for poultry, it's much, much higher. And these are the labeled doses that we see in the feeds used for cattle and poultry. So I think you can see that if a donkey is exposed to typical commercial feed that is mixed appropriately for these animals, it can be pretty deadly. Okay, so moving on to my example, my outbreak. This all started, it did take place in the fall in upstate New York, and it was actually primarily a beef farm. So these people had 20 to 30 beef cows out in a pasture that was shared with 5 donkeys, standard donkeys. And the donkey population consisted of 2 adult jennies, one of which was lactating, had a 4 to 5 month old foal at her side, and then an adult jack and a yearling jack. These were all commingled on the same pasture, and they were fed the same feed. And they were basically fed baleage, which is fermented hay that's been baled and then wrapped. And then they were also offered a loose vitamin and mineral mix that was put in a feeder out in the pasture for all of them to have access to. The owner was actually aware of the issues associated with ionophores in donkeys, so specifically had found a mineral mix that was not supposed to contain any ionophores. So the outbreak all started one day when this guy went out and found one of the adult jennies dead in the pasture. Of course, he didn't know that this was the start of something larger and didn't call a veterinarian at that time, disposed of the carcass. But then 2 days later, the adult jack and the yearling jack were also found dead in the pasture, and the remaining adult jenny was found down and out in lateral recumbency in pretty poor shape. So at that point, he knew this was a big deal and called the veterinarian. She came out and she was able to prop the recumbent jenny up into sternal, so on her belly. And when she did that, she could clearly lift her head up off the ground. She had good tongue tone. Her tongue wasn't weak. She could retract it. She could drink water. Didn't appear to have any cranial nerve deficits. And according to the owner and the submitting veterinarian, everyone had been okay prior to that, other than, of course, the dead animal a couple days before. But prior to death and prior to this recumbent presentation, the animals had acted okay. And at this point in time, the cattle and the foal were apparently healthy. So this veterinarian, due to the perceived poor prognosis for this down jenny, decided to euthanize and submit both the jacks and the jenny to our diagnostic lab for a necropsy. So all 3 donkeys were submitted. I put in here just a few notes that the veterinarian passed along to us, one of which you all might be thinking about botulism, as I was, because of the fermented feed that was being fed, but that was kind of lower on her list given the presentation and the physical exam findings for this jenny. She had really good tongue tone, so she was thinking about botulism but had put it way down, but we were all thinking about possible toxins at this point. So I will tell you that we did some ancillary tests, we did some cultures, we did some viral testing. All of that was pretty much within normal limits. The necropsy results as well came back fairly unremarkable. So I have them up here. I don't expect you to read all of this, but basically the take home was that all 3 donkeys grossly had some pericardial effusion, so some fluid around their hearts. Their lungs were slightly heavy and wet. And then importantly on so examination of the tissues at the microscopic level showed the adult jack had one little area, one focal area of possibly the start of necrosis in the heart muscle. That was really it. Otherwise, it was really pretty unremarkable, and we were kind of stretching to figure out what was going on. So still high on our differential list is toxin, and we know certain plants can cause sudden death like this. The veterinarian had searched the pasture, couldn't come up with any sort of cardiac glycoside-containing plants. We really couldn't figure out how they could have gotten a hold of any sort of poisonous plants, so we started to think more about ionophores, and we decided to kind of go down that road a little bit further. So the veterinarian went back to the farm, grabbed 2 unopened bags of the mineral mix that was being offered to these guys, and also went out into the pasture and scooped some right out of the feeder and submitted that as well. And we did our ionophore screen at our lab, which will detect the ionophores that I have listed up there, which I mentioned are the most common ones that we see. And lo and behold, all 3 of them tested positive, and not only for 1, but for 2 ionophores, both monensin and lasalocid, were present in the feeder sample and both unopened bags. So just to step back for a minute from the case, I just wanted to go over some of the clinical signs that might be present when an equine ingests ionophores. You don't always see these signs, but you might if you have an observant owner and maybe a single animal. It's a little bit harder in a group of animals in this type of situation, but you might see anorexia. So that's probably the most common thing that's seen first off. Some of these animals develop diarrhea, and some of them develop muscle weakness. And if they're on, kind of a maybe lower level of exposure for a longer time, you might even see muscle wasting. Some of them become incoordinated. They become ataxic. They might develop abdominal, signs of abdominal discomfort, so some colic signs, because again, I mentioned it alters the gastrointestinal bacterial populations. They might show difficulty breathing. They might sweat. They might go down like that Jenny did. They might have a higher heart rate or maybe some arrhythmias. And if they're an athletic animal, if they're used for work, then the owners might report that there's some poor performance or exercise intolerance. And of course, you might just see sudden death. And it's worth noting that there is not, none of these signs are pathognomonic for ionophore toxicity. There really isn't anything that, you can look for and say, oh, if the animal's got that, it's got to be ionophores. It just doesn't work that way. So they're all pretty vague general signs, if they're there at all. And then if you have an animal prior to death that you're able to do a blood chemistry on, you might see some changes. Again, none of these are pathognomonic either. So, and they're not specific, I should say, for ionophore ingestion. But you might see some decreases in certain electrolytes, and perhaps some increases in some muscle enzyme values. And then I highlighted at the bottom the cardiac troponin. This is a test it's not run routinely because you need either really special sample handling. So if you're drawing a sample for a blood sample for cardiac troponin, you need to separate it right away, send the plasma in on dry ice. It needs to be handled appropriately to test it in a lab, or you need an iStat machine out in the field. So it's not something we see all the time, but cardiac troponin is, again, not specific for ionophore toxicity, but it is specific for injury of the cardiac cells. Okay, and then on postmortem, as I mentioned before, some of the things you might see, things that are consistent with heart failure, so pericardial effusion. Again, you might see areas of pale or hemorrhagic, areas in the heart or skeletal muscle. Histologically, you can see degeneration and possibly necrosis in the heart and skeletal muscle as well, but again, these don't always have to be there. So you very well may see nothing at all. So unfortunately, too, there really is no antidote for ionophore ingestion. So if you have a real recent exposure, like maybe you walk into the barn and you see your donkey, tearing open a bag of chicken feed or something, you can possibly do some gastric lavage and administer activated charcoal. But otherwise, really everything we do is just supportive. So you might administer vitamin E and selenium to try to help combat further cellular damage. And of course, rest is important. So if this is a working animal, or even if it's not, you just want to try to keep them as calm and remove any stress, and realize that their heart might be compromised. So what happened in this case? Well, the offending mineral mix was removed, and the results, we did get permission to share the results of our ionophore screen with the company who is manufacturing this mineral mix. And when we did that, and we had this discussion with them, we did find out that they do have lasalocid and monensin in their feed mill, because they are manufacturing feeds that contain those ionophores. So it was present in the facility, which gave us more suspicion that there was either a mixing error or contamination. And then we contacted our state veterinarian as well, and he gave us permission to send samples that we had received, some of our samples, to their food testing lab, the New York State Department of Ag and Markets Food Testing Lab. And then because this is animal feed, it's regulated by the FDA, the Food and Drug Administration. So they were contacted as well, and an investigation was initiated at their level too. And they actually sent employees out to the farm to do an investigation and collect samples as well. So the results came back. So we had done qualitative tests, right? We had just looked to see if the ionophores were present or not present, because that was important to us. They weren't supposed to be there. These guys actually did quantitative tests. So both the FDA and the state food lab found monensin and lasalocid present, again, in the feeder sample, in the unopened bags as well. When we contacted the manufacturer of the mineral mix, like I said, they really didn't believe that this was the cause of death, and they wanted us to send some of our samples to them. We did. They passed it on to the manufacturer of the ionophores for testing, and they tested the samples and said no ionophores were detected. So we had to go back to them and say, well, what's the limit of detection for your test? And they told us, and their limit of detection was 0.9 parts per million, which was not as sensitive as all the other tests that were being run. Then we did test some gastrointestinal contents as well. So from one donkey, we tested stomach and cecal contents, and we did not detect any ionophores in those samples. And I'll talk a little bit about why that may have been. So overall, given the presentation, the sudden death in multiple animals, the histologic findings that, although we didn't find a lot histologically, there was that one focal area, and the presence of ionophores in mineral mixes that were being offered to these animals, we gave it a final diagnosis of ionophore toxicity, which didn't make the feed company very happy. And their big question to us was, well, fine, if it was ionophore toxicity, and all the donkeys had exposure, why is there this one remaining foal that survived? So we talked to the submitting vet, and we talked to the employees, the FDA employees who had visited the farm, and they said, well, that's really simple. The foal was too small to reach the feeder. So it was the only one that didn't have access. Unfortunately, that's really sad, but at least we had one survivor. So I think important considerations in a case like this, there are many. So I think the takeaway message should be that diagnosing ionophore toxicity is really difficult. And that's the reason that it's so difficult is really multifactorial. So for one, these are often the result of either a mixing error or contamination. So the equipment, if you're getting feed, commercial feed, from a manufacturer that has ionophores present in the facility, if they're not doing a great job of preventing cross-contamination, you can have residual contaminated feed present in the machinery that can end up in your bags of feed. And as you saw, all equines are really, really sensitive. So unfortunately, though, that means that it might not be uniformly distributed, right? So you might have, one animal that gets a big slug of it, another animal that doesn't, and when you go to test it and you grab a sample from a bag, that sample might look different than another sample that you grab. So that becomes a problem when you're trying to test for this and make this diagnosis. And then also an issue is that you don't always have lesions, grossly or histologically, depending on how much they were exposed to and how quickly they die. And then also, in this case in particular, there aren't any toxic ranges established specifically for donkeys, so we don't know. Are they more sensitive? Who knows? And we don't know about any synergistic effects in donkeys or horses. So in this case, like I mentioned, we had 2 ionophores present in this feed that was not supposed to contain any ionophores, and I don't know how that might differ from just monensin alone or just lasalocid alone. And then another really big problem with these is that when you have an animal that is dead and you suspect that it ate an ionophore, that sample you really want for testing is the sample that was eaten. So all we have is what's left, and what's left might not, because of the fact that it's not uniformly distributed, the remaining feed might not be the feed that you need to make the diagnosis. So that's a problem too. And then it may seem like a good idea to test GI, contents, and sometimes it is, and sometimes we get lucky and it's there, but other times it's not. And I think the reason being, they ingest this, they get anorexic, so they might go several days without eating, and then it's gone, or it gets absorbed, or it gets diluted by other feedstuffs and water that they're ingesting. So for all of those reasons, it's pretty tough to make a diagnosis, but I would just say, if you have sudden death in an equine that's being fed a commercial feed and you at all suspect this, make sure that a necropsy gets performed, and certainly if you see any lesions that could be consistent with it, have it on your differential list. And work with your state diagnostic lab and your state veterinarian and involve the FDA